Hi there, my name is Jamie and I am a nurse injector at MeiRai Medical Aesthetics in beautiful Roseburg, Oregon. Today we are going to be talking about one of our favorite procedures here at MeiRai, microneedling. And along with me, I have our absolutely beautiful model, Brittany, who will be joining us. So come along if you want to learn about microneedling and see what it's all about. Microneedling is one of our favorite procedures here at MeiRai Medical Aesthetics for many reasons. Number one, because it is just such a well-tolerated procedure. All skin types can get this procedure. Now I say that all skin types, but there are some skin conditions that shouldn't receive the procedure, and we'll get into all of that in just a moment. First, let me just tell you about microneedling itself. Another term for it is collagen induction therapy. So just as it sounds, what it's doing is it is inducing the body to grow and produce more collagen. And the way this happens is we use a microneedling device. The one we have is called the Skin Pen by Bellis Medical. It's a wonderful pen. It was the very first FDA approved skin pen device, and I believe is still one of the very few that is FDA approved. A great machine. It's very safe. There are many things in place with this skin pen to help prevent any type of infection. It gives a nice even skin tone, and it's a very quick, wonderful pen to use, so we're very happy to have that with us. Reasons that you would want to get microneedling. It is wonderful for already fine lines or deep lines that you might see. It's wonderful in preventing more lines or wrinkles. It is great for acne scarring. That's one of the big things that they actually promote this for, is for acne scarring. Not only on the face, but it can be used on the neck, can be used on stretch marks as well, other types of scarring, surgical scarring. We could use it on the back as well. Today we're just gonna stick with this beautiful face here. So Brittany's already arrived. Before we had a medical consultation with her just to find out what her goals are, what she wants to achieve. We do have our medical director, Dr. Yoon. He does a consultation with every medical patient prior to their procedure. So he can make sure that there aren't any reasons the patient shouldn't have the procedure, and again, to find out their goals and how we can best tailor it to them. So she's been through that process. And then she has also been through a cleansing. We cleansed her. We use a lot of ZO products, which you might have heard of. That's Dr. Zane Obagi. So we cleansed her with a Foma Cleanse by ZO. And then we applied a 4% lidocaine cream. Now we like to give our patients a little bit of numbing beforehand. The skin pen says that it is gentle enough that it can be done without a numbing cream. So if that is something you would prefer, that is an option that you may have, but we do like to leave the numbing cream on for about 20 minutes. So you'll first get here, get a cleanse, get the numbing cream on. We'll take that off and then we degrease with alcohol. So Brittany has had all of that done. We've just done the degreasing and she's now ready for her microneedling procedure. All right. Do you have any questions for me, Brittany, before we get started?
No.
Okay, wonderful. So what we're going to do, there are various serums that you could use to actually microneedle with. The microneedle pen has 14 little needles in it. And that's what's actually going to glide over the skin, cause little micro injuries into the skin, which then induces that collagen. It's just telling the body to heal itself. So we can use various different serums, like I said, to be able to do this. Today we're going to use a hyaluronic acid serum, and that's kind of a big buzzword right now in skincare. It is a glycosaminoglycan that adds moisture and helps with the plumping of the actual skin. It's found within the skin, but with microneedling, not only are you puncturing the skin to heal itself from within, but you can also be getting these serums kind of penetrated into the skin as well, so you can work at it both ways. The skin pen has a hydrogel cream that we could also use to do that. Again, we're using the hyaluronic acid today. Other options, you've probably heard of PRP, that's platelet-rich plasma. That is where we actually draw the patient's own blood. We spin it down in a centrifuge, and then we pull out the growth factors. That's another big buzzword that you'll hear, are growth factors. And we can then microneedle that serum, the patient's own serum, onto the skin, onto and into the skin. We also have a couple ZO products that can be placed into the skin. We have a Bright Alive, which is for a nice bright complexion, and we have a growth factor with them as well. So many, many options, so don't hesitate to call us and find out what might work best for you. And again, let's get this started here. So what I'm gonna do is I'm just gonna apply a little bit of this hyaluronic acid onto her skin, and this is gonna help glide the pen, and then again, it also is gonna penetrate into as well. So I'm gonna go ahead and just start the pen. It is a little bit loud. I'm gonna dial it up. The pen can be dialed up from a 0 to a 2.5. We're gonna start with just a 0.5 to see how she does. All right, Brittany, here we go. So I'm just gonna start with just a little area on the cheek here. What we're looking for is a nice redness. And we're already getting that from her right in that little patch. That's really nice. Is that tolerable for you? Yeah, okay. We're just gonna continue because she's doing so well with that. You might see a lot of videos where there's a lot of blood. That is not bad, but it's not necessarily have to get to that point. What you're really looking for is this nice redness, and you might see a little bit of pinpoint bleeding too. So we're just gonna work all the way around. So Brittany, on a scale of 0 to 10, with 10 being the worst pain, childbirth, what would you rate this as?
Oh, I'd say 0 or 1.
Oh.
I think it's painful. It's just vibration.
Up vibration. Great. Okay, thank you. Now the cheek tends to be the least sensitive area. So when I get into some other areas, we'll ask her as well. Some areas like right under the eye and the forehead can be a little more sensitive, as well as around the lip. But again, we've numbed all of those areas and it should be very comfortable for her. And I'm just gonna go around, and this pen is nice and quick, again, a nice and even. She's getting a nice redness, so I'm not having to dial up or down the pen at this moment. We'll just keep checking in with her. So again, when you come in, expect to, after you get that initial consult, come in, get cleansed and numbed for about 20 minutes, and then this procedure actually takes probably 15 to 20 more minutes. So that's the time that you should expect to be in. You're still tolerating this great, Brittany? Mm-hmm. Wonderful. So more things that we love about microneedling. There's very little downtime. In fact, if you don't mind going to work or school with just a little bit of redness the next day, you're not gonna have any downtime at all. You can be out in the world. Within the first day, you'll probably be like you had a sunburn. You might feel like that, and you might look like a little bit of a sunburn. About day 3, you might get some redness, some dryness, some itching and flaking, and that's perfectly normal. That's actually the body's healing process. So those are normal reactions. So I'm gonna go on Brittany's nose here, and I'm gonna dial it down just a smidge. The nose can be a little bit tickly. Brittany, let me know if it might cause you to want to sneeze, so let me know that, okay? So I'm just gonna hold on here. Yeah, so you just have that redness, that flaking, some itchiness, all very normal, all reactions we actually want. And those can be lessened buy the hydrogel that we sent home with you from the Skin Pen, or a renewal cream from the ZO line and things like that. So there are things that we can do to make sure that you're comfortable with those normal reactions. Then about the fourth or fifth day, you are gonna wake up with amazing skin. I was amazed the first time I had it. About that fourth day, my makeup went on so smoothly, and it was incredible. All right, this is another sensitive area, Brittany, so just let me know if it's not tolerable. Your skin is reacting so well to this. Along with little downtime, as you can see, it's very tolerable. There's also a very small risk of infection because we're using your own body. Every patient gets a brand new cartridge. These are all sterile cartridges with the needles. Our Skin Pen is washed, and it is also protected by a plastic sheath. They have some built-in mechanisms to stop any blood from actually going into the machine. So lots of infection prevention. I'm gonna pull this back just a little bit. I've gotten questions before about at-home microneedling, which is very popular, and the benefits of actually doing it in a doctor's office. Of course, we have a nice sterile environment, which you may not have in your home. You know, you might have animals running around and things like that. It's just not the most sterile environment, so it really helps to come in that type of environment. Also, some of the at-home, there are rollers that you can use, and those can tend to tear the skin rather than just create these nice little mini punctures. So I'm gonna come right in here, and I like to work this area well. It's very nice for the crow's feet. And again, you're seeing just a nice redness that she's getting. We've got a little pinpoint bleeding there, which is great. We'll take that. Now this can be a little bit tender in here, but it looks like she's tolerating it very, very well. How's that feel, Brittany? Good. We're gonna get right here. This is the glabella area, which is a nice, this is a very popular area to get Botox, which we also offer that as well. But this microneedling really helps prevent those furrow lines there. At-home care, I kind of started to talk about that you'd be a little bit red the next day. You want to try and at least leave, I'd say 5 hours or so before you wash your face, just to let all these channels stay open, all this goodness seep into that skin. You won't want to use any type of exfoliator, retinol, any kind of acidic type product, alpha hydroxys, beta hydroxys, until your skin is not red, until it's healed. So probably about 5 days or so. Then you can go back to your normal products. You want to be careful about going out into the sun because you'll be extra sensitive. So if you can't stay out of the sun, go ahead and use a sunscreen. So again, a great procedure with high efficacy. You'll see definite improvement in one treatment, but we do recommend doing 3 treatments about 4 weeks apart, and that's going to give you your optimal results. And this is looking absolutely beautiful. I think I'm just going to feather it down a little bit on you, Brittany, okay? All right. So I'm just going to bring a little bit down here so you can't quite see that line there. Brittany, with your past treatments, did you have kind of those after effects of the dryness and the itching? Did you get any of those?
Not too much.
Not too much, okay. That's great. So again, just working that, just want that nice, she's got that nice, beautiful evenness that we want. looks fantastic. So what I'm gonna do is I'm actually gonna turn this pen off, and then I'm just gonna rub that hyaluronic acid in. Because again, we've created those channels that are gonna heal from within, but then we can also get this nice and infused as well. And I hope that you have enjoyed our video. That is what we do here with our microneedling, which we love, and we would love to see you. So please don't hesitate to give us a call, check us out on Facebook. You can check us out on our webpage, and any of us would be happy to speak with you. Please come down and see us at MeiRai Medical Aesthetics.